Welcome to KACF's Giving Summit virtual series, In the Frontline of COVID-19 Essential Stories. I'm Chang, the president and co-founder of the Korean American Community Foundation. As many of you know, KACF is the first and largest funder of Korean American nonprofits, and many of them have been on the front lines since day one of this pandemic, providing urgent and essential services like food, shelter, and economic assistance for struggling and vulnerable people. We're hearing heartbreaking stories about families thrown into crisis. For example, one grantee partner was telling me that before the pandemic, they would receive about 10 to maybe 20 domestic violence hotline calls, but now it's 50 to 60 calls a day. We're also seeing an alarming uptick in rates of depression in our elderly population, who are isolated, lonely, and living in fear. At the same time, we're also witnessing acts of incredible heroism, selflessness, solidarity, and generosity. We launched our Giving Summit 4 years ago to create an opportunity to learn from each other and examine how all of us can contribute to making a difference in challenging times. And at this time, we see KACF's role to be a bridge to what is happening on the front lines. So what our nonprofit partners are seeing was the focus of the first virtual Giving Summit last month. And that was soon followed by our second event featuring medical professionals who are literally saving lives in this health crisis. And today, we're pleased to host a conversation with Juju Chang, the co-anchor of ABC Nightline, and also a co-founder of KACF. Juju has been on the front lines of covering the stories behind the pandemic. And this program will be moderated by none other than our own KACF board member, Jeannie Park, former executive editor of People magazine and the visionary behind the Giving Summit. So now it's my pleasure to turn things over to Jeannie.
Thank you so much, Kyung, and I'm delighted to be moderating this conversation with our good friend, Juju Chang. Juju and I have known each other for a very long time, since we were in our 20s. And I'm not going to say exactly when that was, but it was definitely before some of you were born. We were both very involved with the Asian American Journalists Association, as was Kyung, trying to support other young journalists. It is so meaningful for me to be still connected with both of you, Kyung and Juju, but now through our work on behalf of KACF, trying to support the Korean American community. Our talk today is called Essential Stories, and Juju herself is an essential worker, anchoring ABC News' Nightline, which is now devoted full-time to the news we all need to know about COVID-19. Juju, thank you so much for being here with us today. I know you're going to take us behind the scenes on some of the stories that you've covered, but first, I just wanted to ask how you and your family are doing.
I am so pleased to be here with you, Jeannie. I am especially thrilled to see your parents in the square box. Hi, Mr. and Mrs. Park, good to see you. And I'm glad to know that your parents are well. My mom is doing well, and she's part of that group of elderly Korean Americans who are getting cabin fever and being not very compliant and being very restless. And I wish I could hear from all of you because we could give each other some comfort and perhaps some aid. The first question, before I launch into how my family is doing, I just want to say Jeannie introduced me as someone who was involved like her in KACF. That is a huge underestimation of what Jeannie did. Kyung and I were involved. Jeannie lifted AAJA from nothing into this major force in for good in journalism and for Asians and Koreans in journalism. So hats off to you, Jeannie. As far as my personal update, I would say for the last 6 weeks, I've been separated from my family because my husband had pneumonia a number of years ago. My son, who's a freshman in college, got mono. Don't tell him I told you that. And just just got over. And so I just sort of wasn't sure what COVID would do to either of their systems. And we are blessed and privileged enough to have a weekend house. So we sent them to Connecticut along with my sister-in-law and my brother, who is undergoing treatment. And so everyone was a little bit on the immune compromised, let's not take any risks. And since I was going in and out of ABC News, I didn't want to cross-contaminate. I just didn't want to mess around. So for 6 weeks, I haven't seen my family. What that meant for me was very sort of disorienting, right? Because I'm used to living with a dog and 3 kids and lots of family around. And so to be kind of almost monastic every other day, walking to work when the streets were completely deserted. I don't know how many of you stayed in Manhattan, but it was a ghost town. And the only thing you would hear are the sound of ambulances. And over time, more and more people started wearing face coverings. I started taking Ubers home, and I have a collection of really ingenious, because I would have to come home at like midnight. So I would walk to work, take an Uber home, and I started a picture collection of all of the ingenious Uber drivers who started taping up shower curtains, behind them in order to protect themselves from their passengers. And, imagine what that's like, being an essential worker, having to protect yourself from the person that you have to interact with in such a short distance. But aside from a few shoots, most of my work was done in the studio. So I would do satellite interviews, which you'll see photos of, or I would do that's the kind of laptop satellite interview that I would do, or I occasionally would go out into the field and I would have a 6-foot microphone, a boom pole, to keep social distancing. So that was a story that we did in Connecticut at Stu Leonard's, talking to the essential workers who were putting food on our shelves. And I think all of us had a renewed appreciation for the people who don't have the luxury of working from home. Because being able to work from home and being on a Zoom meeting is a privilege, one that we don't think about when we're frustrated by the 17th, conference call of the day. But a lot of times it puts things in perspective.
So when you're at the office, and I'm glad to hear your family is safe, Juju. And so when you're at the office, are you with other people, and how are you kind of taking precautions there?
So ABC News has reconfigured like every other, large corporation, and we have just a skeletal crew. We've shocked ourselves at the amount of work that we can complete from home. So for example, when you watch World News Tonight with David Muir, the editors for each of those individual pieces are editing from home. So we've sent home laptop editing and uploadable capability. I'll turn this around for a second. You're looking at me from my home studio, which ABC News set up with a phone, I don't know if you can see it, and some big lights. And I can dial up to our digital control room and they put us on the air. So if you watch any kind of television, you see the various correspondents and they are uploading from their homes up to a digital satellite. We've put graphics at home. We've had some people directing from home. We've had a lot of writers, researchers, reporters working from home. So I'm among the very, very skeletal staff. I also have this photo, which I took of our cleaning crews, right? Another sense of the set of the invisible essential workers who are scouring down office areas. And while you guys are working from home, offices are rethinking how we social distance, who has to wear a mask, how often do hotspots need to be cleaned down, how do we do, my brother's an architect, he's talking about like touchless doorknobs and touchless entry points. So there's all sorts of revolutions swiftly taking place in the workplace while this is all happening.
So tell us the truth, are you wearing sweatpants right now?
Absolutely.
I'm in super ripped jeans. So.
Exactly. Here, let me share with you this image. These are the essential workers, right, at ABC News, who are wearing masks, wearing gloves, and they go around the office constantly scouring for hotspots, for high density areas.
So let's talk a little bit about the stories that you've been doing. I mean, you've been covering COVID from many, many different angles, the frontline workers, the debate about when states should reopen, personal stories of surviving the disease. And I know you did a story about doctors at Elmhurst Hospital, which serves mostly immigrants and was one of the most overwhelmed hospitals in the country. Can you tell us what you learned from that?
Sure. Elmhurst, as we well know, is adjacent to the areas near where the Korean population is so high. Queens is such a high density immigrant population. There's the doctor at this Elmhurst clinic told me there's something like 128 languages that are spoken throughout Queens.
Wow.
It's one of the most, sort of intensely melting pot communities, right? But as a result, when you look at the new immigrant community in Elmhurst, what was happening there is a microcosm of a lot of the hotspots across the country. It is a microcosm and a metaphor for COVID hitting the immigrant population, because the doctor said, we were a small little clinic. We weren't prepared for this. People were coming in with coughs. My staff in this little clinic didn't have PPE. They were swabbing people for what they thought was strep or the flu, but meanwhile they had COVID. And so it spread like wildfire through the community because a lot of recent immigrants don't have access to proper health care. So they are either going into an ER, spreading it. Then she said, and then think about where they go. They live in high density settings in urban areas. So when you look at Detroit, New Orleans, Chicago, a lot of these inner city areas where even though the percentage of African Americans population is like 30%, they represent 60, sometimes 70% of the COVID deaths in an area because of the disproportionate high density or the fact that in Elmhurst, a lot of them there's a disproportionate amount of essential workers. So Governor Cuomo has said that essential workers are 40% people of color, right? And they are people who are therefore more likely to be working during this time. Again, these are people who don't have the luxury of working from home. So they have to get on subways, which are crowded, which are dense, which are, basically fertile ground for pathogens. And because all of those truths sort of stack up on top of each other, and then add to it the new layer that we're learning about COVID, which is that the underlying conditions that we thought we were afraid of, which were, asthma, lung infections, and those kinds of underlying conditions, it's actually more to do with diabetes, hypertension, obesity, high blood pressure, also conditions that are disproportionately affecting people of color in urban areas. And I know Sarah, who worked in New Jersey, told me a fact that I didn't know, that Korean Americans are more likely to suffer from diabetes as well. And diabetes is a huge underlying risk factor for COVID, which is sort of, it's not obvious. It's counterintuitive, and yet it very much is.
There's certainly, a lot of underlying factors in society that this crisis has uncovered, and that will have to be dealt with. And you talked about the essential workers being disproportionately immigrants, people of color. So what other, besides the healthcare workers, like at Elmhurst Hospital, what other essential workers have you been speaking with and reporting on?
So we did a story out of Sioux Falls, South Dakota, which, there's been this big debate over city, urban versus rural environments. Well, Sioux Falls and the Smithfield pork processing plant was for a time the hottest cluster of COVID in the entire country. The only thing that eventually overtook it was the USS Teddy Roosevelt, the aircraft carrier, which became a bigger cluster. And the reason why is the same reasons that Elmhurst became a hotspot, because of the high density, because of the lack of social distancing on the assembly line. If you look at pictures of these workers, and again, a huge proportion of immigrants. I spoke to one worker and a number of worker advocates, right? Like labor organizers who said the workers were begging for PPE, they were begging for social distancing, and for weeks they weren't getting it. And then weeks later, you saw the fallout. Smithfield became, a hotspot. And so they had to shut down the plant, even though the governor of South Dakota was one of the ones who decided to ignore the statewide shutdown order. And then the mayor of Sioux Falls ended up trying to issue one. And so again, this is an immigrant community that is not just Hispanic, although the employee I spoke to was from, I think, Honduras. She described, again, a melting pot, immigrants from Nepal, from Africa, who work this assembly line. And a lot of these jobs, these essential worker jobs, are like the key to social mobility for immigrants.
Right. And so now at KCF, we have a focus on lifting the community up to a place of economic security. And so one thing we're especially worried about, I mean, aside from the disproportionate impact on immigrants of the disease in general, is also the economic fallout from the lockdown, especially because so many Korean Americans own small businesses. So I'm wondering whether you've reported on that and what you might have seen.
I did. So as we all know, America is eager to get back to work. And I don't think that is a political issue. It is obviously everyone's eager to get back to work. And so how we go about doing it is an important sort of next phase in the COVID story. I went down to Brooklyn. I rode my bike from Brooklyn back to Manhattan, which was a fascinating survey of Manhattan, I must say. But I spoke to 3 different small business owners in Brooklyn, right, in Park Slope. And they all talked about sort of the need to social distance. This is the owner of Diana Kane, a small little clothing boutique. And she's talking about how every night she knows that her neighbors are, could potentially be in the ambulances that she's hearing go by. And so she doesn't want to risk any of her neighbors. And yet at the same time, that store that we were standing in front of represented 18 years of her blood, sweat, and tears. And she said, in 2 months, I'm almost belly up. Right? Like I cannot survive if there isn't some structural change. And so getting at that, and I realized that my heart went out to her so much because, I'm the daughter of a small business owner. That's the, immigrant dream is you can't potentially, if you can't make it on the corporate ladder, a lot of these small businesses are owned by immigrants or by women or by people who don't have access to the corporate pipeline. And I think that when you drill down into what small businesses need, the Paycheck Protection Program puts a lot of constraints on the way small businesses use that money, which is problematic because 75% of it, for example, has to be earmarked for payroll. And that's not particularly helpful for some small businesses who need to spend that capital to pivot in order to survive in the new COVID age. So they're looking for things like, so these neighborhood coalitions are looking for ways to pivot their businesses toward curbside delivery or online, or to restructure or change their capital environment. So one of the small business owners I talked to was a hair salon owner, and it's so easy to visualize, right? She has this salon, it's got 6 chairs. But now with social distancing, she's going to have to cut that down. Does she extend hours? Does she move upstairs? But she needs capital improvements in order to do that. So the PPP doesn't help her. The last thing she wants to do, and she ran the numbers for me on the back of the envelope, the last thing she wants to do is run up more debt, right? And at the same time, I interviewed via satellite small business owners in Texas, in the heart of Texas. And that's one of the images that you saw. And, the small business owner I spoke to said, listen, my sister has advanced stage brain cancer. I am not going to endanger her or anybody else. I am reopening responsibly. I'm wearing a mask. I'm asking my clients to wear a mask. I have a 6-foot hook pole that I'm putting merchandise on and putting it in the back of the truck. So we are, but small businesses, in her view, and I think a lot of people would agree, are the backbone of the community. Small businesses in New York, businesses that employ fewer than 100 people, make up the vast majority of employers in New York. I think we lose sight of that.
So I wanted to bring up another story that I know you have a personal connection to, and that's the story of anti-Asian racism that has come up so much since this crisis started. And I'm, wondering whether you've covered that and sort of what has been your personal reaction to that? Have you had any personal experience with it?
I'm grateful to say I've had no personal experience with it, but when it flared up and when it became clear that there was an uptick in violence, we did a story at Nightline. And we examined a couple of incidents. And, when you drill down into any one of these incidents, they're horrific. There was a young boy who was stabbed. There was another kid who was bullied in school by his own teacher. We used an example of Daniel Day Kim, who talked about the fact that he got COVID, right? And he just couldn't understand when he talked about the fact that he got COVID, that he was getting all sorts of online hate of people saying, oh, it's the Chinese virus and da-da-da. And, we all know that the Chinese virus and that kind of lexicon is incredibly, words matter. Words make a difference. And he was joking that, he believes he got COVID while in New York on location shooting for his TV show. And he said, if you were to ask me, I would call it the New York virus, because that doesn't make sense either. Geography doesn't define the virus. And, in our piece, Terry Moran, one of my former co-anchors, looked at the history of that kind of scapegoating, that pandemics have been weaponized against certain populations throughout history, whether it's the Spanish flu, which ended up actually originating from Kansas, or AIDS and how that stigmatized the gay community. There are time and time again examples of how pandemics create hysteria. And when people are pent up and frustrated, they are looking for someone to blame.
Thank you. As we mentioned at the start, you and other journalists are essential workers too, because it's so important for the public to have accurate and up-to-date information. And I know I'm consuming more news than ever before. This means that journalists also have been getting COVID-19. And I'm wondering whether your newsroom has been affected.
It has. I don't know if you can hear, but there's an ambulance going by right now. There have been, there was a gentleman who worked in audio who died of COVID at ABC News. We had a colleague, we've had multiple colleagues at Nightline. So ABC News is made up of a bunch of different shows. Our team is probably about 60, 70 people. And I would say a dozen had either tested positive, presumptive positive, or we're fairly sure they got symptoms. So I believe the latest estimate is that 20% of people in New York City have been exposed and have antibodies. That's the estimate based on extrapolation on testing. And that there's a sense that that might even give New York a little bit of flexibility. People don't like the phrase herd immunity, but it's a little bit harder. So my next door neighbor believes they did too. So I won't be able to get, COVID from that particular neighbor, or my office next door mate, because he lost his sense of smell and he was feeling a little crappy for 3 days, but he's fine now 3 weeks later. So he's now returned to work. And the real difficulty is the unknowns of how long are you contagious? How contagious are you? How long are you immune? Just how immune are you? And that is why testing is such a critical and frustrating part of this story, because we know that Korea got it right in so many ways, and the US keeps screwing it up, not just in the viral testing, but in the antibody testing. So I could go on and on about that.
I think, a lot of us probably could.
Yeah, so, we've all become mini epidemiologists.
Exactly. So I just wanted to remind everyone in the audience that we will be taking Q&A in a few minutes. So if you have any questions for Juju at all, please put them into the chat. If you go to the chat icon at the bottom of your screen and send the chat to the person marked Q&A. You'll see that in the drop-down menu. Okay, she just sent a message to you. Kat, thank you. We will get those questions to Juju. So
I see my sister Haley on. Hi.
So can you tell us about any other stories that have touched you that you've done in particular?
Well, I was just looking down at my notes. I was talking to restaurant owners, and New York is so vibrant in part because we have so many amazing restaurants, right? Whether it's your small local restaurant, or it's the big tourist attraction, or it's the fine dining, whatever it is, these restaurateurs say, we don't just feed you, we nourish your soul. Right. And of all the job losses across the country in March, 2/3 of them across the country are restaurant workers. And again, the way that it was described to me was I just reframed the way I was thinking about it, which was, again, the restaurant business, like a lot of small businesses, there are no barriers to entry, right? You don't have to have a fancy education to work in the restaurant business. And yet the ladder to success is sort of limitless. And so I talked to one guy who was a DACA, a dreamer, right? Born in another country. His mother brought him here. He was, part of the deferred action. And he had started as a dishwasher, as a busboy, as a making money because nobody else would hire him. He wanted to be a journalist, actually, he told me. He got a college education. He worked his way up. He started a little coffee shop with like $10,000 that he scraped together. He managed to work and work and work. And now he finally got off the ground. His little sandwich shop, coffee place, employed 10 people. He was, just starting off, and it all came crashing down. And his whole American dream just poof like this. And because he's undocumented, he cannot qualify for PPP. He cannot qualify for, a lot of the unemployment paychecks that people are getting. And so that struggle to me reminded me of some of the communities that we serve at KACF. We serve so many recent immigrants. And what I think COVID has done has laid bare so many lines across our society, because the difference between being able to work at home and not being able to work at home is education. And so access to education is part of what we do at KACF, right? We do after school help for kids whose parents are working all day. We provide, English language for recent immigrants. We do the kinds of things that allow those barriers to be broken. This disease has disproportionately affected people across race, across social status, across education. And I think it lays bare a lot of inequities in our society.
Juju, you're so clearly have, like you mentioned, your family having growing up with a small, you're growing up with their small business, and you're obviously so attuned to the inequities in society. I mean, these stories must affect you so personally and deeply sometimes. I'm just wondering, do you ever find it hard? Like, I was watching a piece that was done, I think, about a nurse who talking about how, all these nurses are like the last human face that so many of the COVID patients will see before they pass. And they're trying to, basically be stand-ins for family in this horrible time when family members can't be together. And I wonder, when you're doing stories like that or talking about them, I mean, have there been moments in this where you've just been, kind of overcome by emotion, or how do you kind of keep it together on camera, I guess, in such a challenging time?
Right.
Such difficult stories.
I haven't been entirely successful. I have had tears streaming down my face while on satellite interview, which says a lot, because, this barrier is a little bit of an emotional defense, right? So the fact that I was crying, the nurse was crying. This was a very similar story that you're talking about. It was an ICU nurse who said, I'm a grizzled veteran. I've worked in the ICU for 20 years and I've seen people pass, but they don't pass alone. And it is, for me to have to be that surrogate is just haunting. And, for me, just on a personal level, right before this hit, my father-in-law passed away, and I was able to be with him, literally holding his hand as he took his last breath. And that, to me, is such a poignant, and it was such a sacred moment. And it was so beautiful. But it's such a stark reminder every day from that day forward, what COVID is doing to families, to the suffering, the despair, and to be at home worrying about a loved one in the hospital is just something that I can't imagine. I will say a couple of things about mental health, and I think it's incredibly important. And I say this because I joked about my mom. My mom, I can tell, is getting frustrated. My sister Haley is tuned in, and she and I have had many conversations about, we're worried about mom. Harmony's getting a little, she's a little melancholy. She's a little, this. How do we keep her occupied? She knows she has a year or so to go of this kind of quarantine. We all know we have 6 months to go before we get on an airplane or see our loved ones or see, and what I will say is that this weekend, after 6 weeks, I saw my family in person, socially distancing. We were both wearing masks for the first time. And I kept telling all my friends, like, I just refuse to dwell on it. And I refuse to, start a pity party, because if I do, then I'm just going to be really sad. So I'm just going to da-da-da. And it's not like a false sense of bravado. That's not what I'm espousing. But there is something about stoicism that our ancestors used to get through the deprivations of the Korean War, of occupation, of the post-war era. And I'm not saying that we need to hold in our emotions. I don't think we should. Actually, I don't think that's healthy. But there is something about soldiering on that's actually really great. And then I take the stories that I've encountered from people who have gone through so much more misery and heartache and pain than I have. And then I was talking to a psychologist friend of mine, and I was like telling them all of this. And she said, what you're doing is what we would refer to as radical acceptance, and then living with gratitude. And I think those two things are things that help us all move forward. And I didn't realize that that's what I was doing, but I think that's really important. Like, okay, we're stuck here. We have no choice. There's nothing you can do about it. Spitting into the wind doesn't help. Doing something productive. I read somewhere that serving others during this time, and think about what KACF offers, right? Serving others during this time is the best way to make yourself feel better. It's a little bit self-serving, and obviously to help those around you. There is nothing like the stories that I get from people like, oh, I delivered meals to homebound so-and-so, and oh, I helped organize da-da-da-da. My other sister, Mimi, and I don't know if she's on the line, she was helping deliver flowers to, the South Asian florists in Seattle who couldn't sell their flowers anymore at Pikes Peak. She's like, every time I do it, it makes me feel good. And I said, that's exactly right. In being in service to others makes you feel good. And I think there's an extension of that for me, going into the office, telling what I see are essential stories, and helping others get that perspective. There's this funny little New Yorker article, little New Yorker cartoon that says, I'm going to stop watching the news because it makes my own problems seem really small. Right? I mean, that's why we keep perspective, because it makes our own problems seem small. And on some level, relatively speaking, they are.
Well, speaking of watching the news, we have a question from Allie Miller, who says, there's a lot of misinformation out there. So what are the strategies for helping folks hear accurate news?
I would consider the source. And it's very difficult. I mean, there was an epidemiologist who retweeted something that was factually incorrect, and it took some number of 45 minutes for that to be corrected. There is, Ted Koppel said it to me in a two-way we did at the 40th anniversary of Nightline. He said, there are people out there with, Twitter platforms that have an audience reach that is disturbing at times, because there is no way to vet what they're saying. There's no way to fact check, really. I mean, unless you do it yourself, which I suppose as a consumer we need to do more and more of. I mean, I think what people fail to understand is that when I say something at Nightline in the midst of a story. It's been fact-checked by a team of fact-checkers. It's gone through a standards department. It's gone through a legal department. You know, we're not just spouting things, right? This is stuff that is, so I think that it's important in this time to really double down on the news organizations that are the gold standard, whether it's the New York Times, Washington Post, Wall Street Journal, but a lot of these regional papers too are amazing, especially in a time of when these stories are popping up all over the country.
Thank you. Allie had a second question, which is that you mentioned and you showed us that you're working from home at times. And so now how do you and ABC plan to return to work with a potential second wave that, you know, everyone's talking about? Or do you think you'll be working from home for the long term?
So today's rare. I actually don't work from home very often. I mean, I alternate with my co-anchor. So every other day I work from home, but I'm not going on camera from home very often. Friday, we're restarting the first Fresh 2020. So if you want to watch, you want a little distraction on Friday night, it's a 2-hour murder mystery. former Chicago Bear football player. It's 2 hours on Friday night. But what we're starting to do is, but that is a good example, Allie, of how we're moving forward. So each of those pieces were edited from home by editors in different locations, 11 different blocks across 11 different commercials. At the same time, for a show like Nightline, we are trying to get back to the studio as much as possible. You'll notice correspondents were popping up a lot from their home, and you could see their like potted plant in their closet door and all that. But we're trying to move back towards the studio setting, or in a more, you know, sort of studio-like setting. We are going to maintain skeletal crews through certainly through the fall. I think there is a collective sense that larger gatherings should be avoided. I was just at Foxwoods Casino on, when was it? Monday? What's today? Wednesday. And looking at behind the scenes, how they're going to lay out blackjack and baccarat and craps, and how you socially distance people rooting for somebody at craps. How do you they put up sneeze guards in front of the blackjack dealer, so you put your chips underneath, but you still have to touch the chips, right? I mean, like every little part of society has to be rethought, reconfigured. And I'm telling you, buy stock in plexiglass, man, because everybody's putting up plexiglass everywhere. I'm kidding.
All right, so Kate from New York asks, well, first she says, I love watching you on ABC. Thank you for sharing your time and stories. And have there been any stories about Korean Americans recovering from COVID? Or maybe stories about Korean Americans that you've covered at all?
Well, the Korean American that I had in our piece was Daniel Dae Kim. I'm trying to think of others. I don't think specifically, no. We were in the small business community of Park Slope. They were female business owners. We've been to small restaurant owners, a Greek diner in Tennessee. We went to a Waffle House in Texas. We've been all over the country, but so far I personally haven't encountered any Korean Americans. I have encountered a lot of New Yorkers, though. I was up talking to a trucker up in Danbury, Connecticut, and he was a trucker from the Bronx, again, another essential worker who had served in the military and done 2 tours of duty in Afghanistan, and, you know, sort of once again found himself serving, you know, his country in this other capacity, risking his life again, arguably, or at least, you know, his loved ones' safety. It is kind of, it's kind of inspiring to meet people. We did a story about another group of what we called the invisible essentials. And we started with the hospital cleaners in I think it was in Brooklyn. Imagine what it's like to get fully dressed up in PPE and then have to clean up after COVID patients, right? And so she's describing to me, it's hot under there and it's exhausting and it's thankless. I can't even communicate with patients anymore because I used to like walk in and like socialize with the patients. I can't do that. but she's a single mom and has 3 kids, and she has no choice but to go and do this essential duty. We talked to a sanitation worker in DC. Once again, like, doesn't have the luxury of working from home. She has to get back on that truck. And she says she gets little notes from people thanking her for working. She gets chalk drawings on the ground. She's an African American woman. She's like, we can't socially distance in the cab of the garbage truck, right? And they're wearing, face masks now and lugging garbage. I mean, like, everything has changed around them. And in that piece, we profiled a Verizon worker who, again, another essential, because we all need good Wi-Fi right now. And he was dispatched and got COVID and died. And his wife and 4 children were, that was another example when I just burst into tears. Like, I couldn't, I'm getting emotional now just thinking about it. Cause like, here's a guy who's, leaves behind a young family because he's out in service of others. And, that may not have been how he thought about it, but that's what his job was. Like, he's an essential worker, and that's what it means to be out on the front lines right now.
There's so many tragic stories like that. And I think all of us are so lucky that so many are willing to put themselves out there. Although for many of them, of course, they have no choice. They need to work. We talked a little bit about the anti-Asian violence, and there's another question here from Barry. I'm not sure if I'm going to pronounce your last name right. I apologize, Barry. He was saying that it doesn't seem like the anti-Asian harassment to him has maybe been getting enough coverage, even though you've covered it and a few other places, but feeling that he's not seeing the issue covered during prime time. And he's asking, do you think this topic is getting the coverage it deserves across media outlets? And I will add on to that question, since we were both and are still involved with the Asian American Journalists Association too. I mean, what do you think Asian Americans should be doing to raise this issue? I mean, is there something that they'll be doing as well?
It's a good question. I mean, I think this is a time when on some level as activists, and I'm not an activist, so I feel like I need to be a little bit, I need to sort of draw that line and be a journalist. It's my job to make observations. And I think that we report on the spike in numbers, we report on the cases that we see, and we hear from people who are speaking out against it, and whether that is the Asian American Journalists Association or the Korean American Community Foundation or the Council for Korean Americans, like that's the time when activists step forward, talk about why this is, and I know that, I think that I'm also happen to be Jewish. And I look at the way Jewish organizations track hate crimes and how important that is. And I do think that that is something that I don't see quite as vividly in the Asian American community, right? So there's no sort of database where you can go to. Whereas if there, whether it's the Anti-Defamation League or the Southern Poverty Law Center, or as a journalist, where to go to get those stats. And journalists love statistics because they don't want to just be making stuff up, right? There's anecdotal information out there, but until somebody's compiling that data, it's difficult. So we reported on the uptick based on a few sort of small data collection sites, but it's hard. And I think that there's also the danger of copycat. If you report on something, sometimes it just sort of stirs the pot. And I think for us, the story was focused around the messaging coming out of the White House task force, right? So that very sort of iconic moment when President Trump stood there with the cue card that said COVID-19, and he had scratched it out and wrote Chinese virus. That was the moment where journalists confronted him. Journalists like Cecilia Vega confronted him in the White House briefing room and said, that is not what the World Health Organization believes it should be called. Do you worry that this stigma will create backlash and violence against Asian Americans. A lot of reporting happened around then. And so I feel like since then, President Trump, there's a lot of reporting around the fact that he and the Chinese have had both, heads of state and lower level talks about this. And President Trump, if you've noticed, has stopped using the phrase Chinese virus. And there are a lot of theories as to why that is. But the bottom line is, I think as a result of the fact that he has been not using that term as much, we haven't been reporting on and seeing as much anti-Asian bias as there was at the height of that moment. Does that make sense?
Yes, thank you. And James Park asks, I don't know if this is a story that you've covered, wondering what you thought about the Maryland governor and first lady purchasing test kits from South Korea, as well as Los Angeles buying them from Korea.
So I thought that was funny because at the same time that the White House coronavirus task force was touting the supremacy of American testing, these local jurisdictions were having trouble getting proper testing. And I think some of it was, we could drill down as to why the testing wasn't working. But the bottom line is these local organizations, including the governor of Maryland, were better off buying them from Korea and then having them land. The next set of complexity had to do with the fact that it sort of underscores the lack of federal coordination, because as Governor Cuomo has said famously from his podium, states were bidding against each other. Maryland was outbid by the federal government in trying to get masks. And so it was so inefficient in that sense. Sometimes capitalism is not the most efficient way of, letting markets go, because Governor Cuomo was saying it would be better if we coordinated and therefore looked at need and then sent, that's why he was asking President Trump to issue federal guidelines and federal rules and regs. But it was interesting to me that the governor of Maryland, who's a Republican, by the way, married to a Korean American, was able to get all of those masks, and that he specifically said, I had the jet land at BWI, Baltimore, instead of Dulles, because I didn't want the feds to confiscate my masks that were coming from Korea. I had the National Guard come out and guard this plane that came in from Korea because its contents were so precious. And so think about what that says about this sort of the federal oversight versus the states. And I think it's one for the historians to sort out, but it's one for us to scratch our heads and think about in the moment.
Yeah, I think there are a lot of questions about masks to be answered someday. Okay, another question from Heian Sun. She asks and says, recently an ER doctor named Lorna Breen, who worked at New York Presbyterian Hospital, died by suicide. Once society is slowly opening, people might encounter all kinds of emotional suffering, loss, and pain if they're not encountering it now already. I'm wondering how the media will cover mental health issues and help people cope with these difficult times in a healthy way.
That's a good question. How will the media cover it? I would like to think that we will sort of continue to see the mental health impacts as a direct result of COVID-19, right? Whether that is we're seeing increases in domestic violence, right? We're seeing increases in, out of China, there was a study that adolescents, almost 25%, I think it was like 23%, reported being depressed because I have two teenagers and a 12-year-old who likes to think of himself as a teenager. And it's just not a natural state for teenagers to be locked in with their parents. This is the time that they're supposed to be getting the heck away from us. I think that that combined with this added stress and uncertainty that their parents are under, added to that, what's interesting is for us, even if we're at home, we can work potentially, and we can socialize potentially. But for teenagers, all of that is cut off. And so, whether it's the elderly or adolescents or, single moms at home trying to Zoom and daycare and social distance learn, it's just a lot. It's a huge amount of quiet trauma that is happening right now. And I would like to think that we in the media will recognize that moving forward.
I have to say, I love being a mother, but I am so grateful right now that my children are adults and can take care of themselves. I look at the Instagrams of my friends with young children and babies at home, and trying to do schoolwork and entertain them and amuse them all day in a small apartment. And my hearts go out to them. So Juju, in this tough time, what do you do to unwind and relax with everything going on, especially since you don't have your family around?
Anybody who knows me knows that I hate being alone. So it's like the strangest thing to me. And there's a lot of discussion about like, are introverts better off during quarantine? And I'm not entirely sure that's true, because I think introverts have connections with just, people that they need to foster. I literally had to foster 2 dogs. So if you look at my Instagram, you'll see them pop up every once in a while. And they have done so much good for my mental health, because they literally force me to go outside if I'm in one of my home days. If I'm in the office, it's like I'm working and it's work and it's normal. But when I'm home without my family, the dogs force me to go outside. They force me to, sort of breathe in fresh air and walk around a little bit. And honestly, I've enjoyed cooking little meals, but that got old really fast. And what else? And meditation. So I would say those are the 3 things. And I'm taking up yoga, which my sister Haley's an expert yogi, but I'm like horrible. I always thought it's like boring and tedious and whatever. So I'm really trying, and I'm doing Zoom yoga and trying really hard.
Well, maybe you'll be better after all of this is done. I'm wondering, sort of as a wrap-up question, whether you think this experience has changed you at all, changed your outlook on society or our country, or just even how you look at your family and what you do. Maybe it's hard to say, we're still in the middle of it.
Yeah. I mean, it's definitely changed us. I mean, as I say, I am filled with so much gratitude that I think it sounds so cliche, but it does make you really drill down into what's important in life, and whether that's your family or your community or your spiritual community. You get to, it's all laid bare, right? And I think that it certainly is another reminder. And I've been saying this to my kids who are just starting out, like my freshman year college son. I said to him, I'm very lucky because I'm in a job where I feel fulfilled. And I feel like in my small way, I'm helping, the greater good. And that is, again, like another cliche thing to say. And yet there's something about that has been sort of reconnected to me during COVID, especially because, it's television, and we've done stories about gigolos and, like makeup and, like you do all that kind of stuff along the way. But then to be reminded that these are stories, essential stories about the deviousness of this virus, the scourge of hate crimes, or the whatever these issues are that we get to tell. That's why I love what I do, and I think that may be the thing that COVID has reminded me of.
Thank you, Juju. We at KACF certainly always have so much gratitude for you, for everything that you've done for the organization over the years, for the Korean American community. So thank you so much for giving so much of yourself to us in this difficult time, and always. And thank you to everyone for being with us today. I think all of us are grappling with the intensifying and unprecedented impact of this pandemic. But this health and economic crisis has hit vulnerable low-income families particularly hard. Through the KACF COVID-19 Community Action Fund that we launched last month, we are supporting nonprofits that are providing critical services to help Korean and Asian immigrant families. We are receiving many more requests for assistance and are issuing a second round of grants this week. So I know we talked about looking for ways to help and serve, and we certainly hope you will consider supporting the COVID-19 Community Action Fund among the many good things that I know that you all are doing. Thank you again for joining us, and Mom and Dad, please stay home. Bye-bye, everyone.
안녕히 계세요.
Thank you, Juju.
You're welcome.